get hooked up quick. Okay. And okay, well, hi everybody. As Jody just said, my name is Delisa. I'm the exercise coordinator for Parkinson Association of the Rockies, which I'm going to start addressing as PAR. It's a lot easier to say. It's not such a mouthful. So, but first, yeah, I just want to kind of get started. Just a quick introduction of myself and what I do as the exercise coordinator for PAR. So I started with PAR back in 2019 as a boxing instructor. And I started because my niece was teaching a boxing class in Arvada for PAR. And as I learned more about it, I was very interested in it. Fitness, exercise has been my life. I was once a competitive boxer, so that was also another passion of mine. And I do have a pretty extensive family history of Parkinson's in my family. So I just knew this was something that was very special and important. And so that's when I got started. I still teach my 2 boxing classes every week. Love it. 2 best hours of my week, really. And then in 2022, I came on as kind of a contract worker to come in and work on exercise metrics. So we partnered with CU Health, their PT research department, and we were gathering metrics from all our several of our exercise classes. And I started with that research project in 22, and then in 2023, I came on full-time as the exercise coordinator. So kind of what I do as the exercise coordinator, I help oversee. Right now, we have about 80 classes that we sponsor weekly throughout Colorado and into Wyoming. And then I also work with approximately 60 of our amazing instructors as well. I also help to coordinate and set up any new classes where we find we have an area where we may see a need for exercise. I also help with that as well. And part I love about my job is helping to guide people to find what could be the best exercise class or program for them and for their needs. And then again, working with the exercise metrics as well is another big piece of my position as well. And so just to make sure everybody is aware that we offer our classes free to those who have with a Parkinson's, a PD diagnosis, as well as a care partner. So just a quick kind of rundown about what we're going to kind of look at today is how exercise has been proven to help slow the progression of PD, how certain exercises can help with particular motor and non-motor symptoms. I'm going to quickly kind of review some of the initial outcomes that we found from about 6 months or a couple testing points of our exercise metrics. And then we're going to, anybody that wants to get up and move, we're going to do some exercise. So we're going to do a little workout. It's not going to be anything too extensive or anything, but we're just going to get up and do just a little movement. So hold on a second here. There we go. So what we want to look at today really is why exercise and how exercise benefits those diagnosed with PD. So studies have been showing us that exercise can help reduce the progression of PD. And what's great too is we find that physical activity can improve motor capacity like strength, balance, posture, gait, so that sequence of our foot movement, and flexibility as well. We also will look at how physical activity can also enhance non-motor symptoms as well. So any cognitive issues, it can help to improve depression, lessen the feeling of isolation, ease stress and anxiety, and also help to improve sleep. So what we're going to look at next then is I have to have my notes here too, everyone, okay? So I'm going to refer to this and this. keep me on track. Are there specific exercises that help benefit some of those motor symptoms? So a lot of times I will get asked this: what is the best exercise or routine program for Parkinson's? And really it's suggested that a safe and enjoyable routine, fitness routine, is that can help manage your specific personal symptoms is really what's ideal. And we're going to review the different specific exercises here. So if we're looking at maybe like a motor symptom, balance might be kind of the issue. Maybe Tai Chi or yoga would be a class that might work well for you. If there's like a lack of coordination, if that's an issue, or you want to work on agility, we can find that boxing and dancing is very beneficial. If there's more limited mobility or significant balance issues, then you may want to look at like more seated aerobic exercises, and water aerobics can be really well for that also. And I don't want anyone to overlook seated exercise. You can really still get a wonderful workout in a seated position as well. So then looking at freezing of gait, so that sudden temporary inability to move. Or if there are maybe more consistent falling or concerns with that, finding a physical therapist who has experience working with Parkinson's, or has more of experience in that area. You may want to look at finding a PT, a physical therapist that can help with these particular motor symptoms. And there's also a program, Big for Life. It's part of the LSVT program. It's a 4-week, more extensive, intensive program that you will become a graduate of this. And then our Big for Life class that we sponsor through PAR is like a maintenance program to that. So if you have become a graduate of Big for Life, then you can take those classes as well. And then last that we're going to look at is dystonia. So that is the involuntary stiffening or contraction of a muscle. It can be in the toes, the feet, even like the cervical area, the calf muscle, so the lower leg. If that's something that may be impacting you, definitely looking at more lower impact exercises. Again, water aerobics is great, very gentle on the joints. Walking, Tai Chi, Pilates, yoga, again, you just really want to look at exercises and activity that don't spur those issues, something that is more, that doesn't bring on the symptoms of dystonia. All right, so moving along, we're going to look at exercise and non-motor symptoms. So with this, learning a new skill, learning a new exercise, that can be really positive for cognitive functions and memory. And then we can really tailor some exercises to work on memory and thinking. I know, like, for example, I have been to many of our exercise classes where there can be, where the instructor will partner up the class participants, and they will combine a physical component as well as a cognitive component. So you may be, like, one example that I thought was a really fun exercise, a really fun drill, where partner up, you take a tennis ball, you'll bounce it to your partner, but your cognitive piece in this, while you're bouncing that tennis ball and working like that eye-hand coordination with that exercise, the cognitive piece is, okay, the instructor might say, all right, I want you, every time you bounce that ball, I want you to name a fruit that starts with the letter P. So you're thinking while you're working, you're moving, you're bouncing that tennis ball to your partner. And then sometimes, you can, if you can safely do it, you can throw like balance, a balance piece into it as well. So you're working that part also. but then you bounce that ball, you name that food that starts with the letter P, like I say pork chops. Then my neighbor has to think off of that, okay, pepperoni. So you have to keep kind of bouncing off of each other and coming up with something new while you're focusing on catching this tennis ball. And it's actually really fun, it's interactive. And then you can mix that up in different ways too by throwing in another either cognitive or physical component to that. So, and then, you know, just like different multitask exercises like boxing. So when you're learning, again, a new exercise, you're learning the punches that we use a lot in boxing. And then after you use those you learn those punches, then you're putting it into a sequence, you're putting it into a combination. So you're constantly challenging your memory while you're working and having fun. Quite frankly, you're having fun too. So exercise has also been found to help alleviate stress and anxiety. It's a wonderful social outlet, meeting new people, making friends, and just working on building that community. So next, so we're looking at how much do we exercise. So I'm calling this the recommended exercise dosage. So before I kind of get into this, we always recommend check with your doctor, check with your neurologist before, if you haven't already started with a fitness program, check with your doctor, check with your neurologist, kind of see what they might tell you, what they recommend to start with, what restrictions there might be. But once you kind of get into that and you find out, okay, I'm ready to start my exercise program, how much should I exercise? So think of exercise like your PD medication. So you don't want to miss a dose. So it's recommended that 2.5 to 3 hours of exercise per week. And we kind of like to look at these 4 different components of our exercise. So with aerobic conditioning, cardiovascular conditioning, you know, you're really getting that heart rate up, looking at 30 minutes 3 times a week. Strength or resistance training, again, 30 minutes 2 to 3 times a week. And we like to suggest that when you're doing strength or resistance training, you do that on non-consecutive days. So you're giving your muscles that time to rest, rebuild, repair. And then, you know, maybe 24 to 48 hours, depending on how you're feeling, you can have another resistance training day in there. And then stretching and flexibility, really that's something you can do on a daily basis. It's really good too if you're feeling some stiffness, some soreness, and kind of like maybe that pain relief. And then also including balance training into your routine at least 2 times a week. And some people ask too, like, how do you know if you're exercising enough? So it might be a recommendation if you can find, if you don't already have a physical therapist, again, who is experienced with Parkinson's, to see about getting an assessment and a baseline. And then you can also then at that point, like every 6 to 12 months or so, see if there needs to be any changes or modification in your exercise routine. And then another thing too that's suggested to be optimal is if you are taking PD specific medication, to try to fit it in there to working out on that on period. So I know it can range, it can be different from person to person, but it could be anywhere from 30 minutes to 60 minutes after taking your dosage. And then also something to consider too is there's a certain time of day where you just feel like you have more energy and you might get a little bit more out of your exercise routine at that time. Okay. And I don't know, I was going to ask this question and I forgot. How many people in here are either taking one of our classes or working out, doing a specific class for Parkinson's, or kind of maybe doing your own activities on your own, if it's swimming, biking, walking? Anybody already? Oh, nice, very good, good. Well, and that's okay if you haven't yet. That's why we're here. We're really, you know, we're really trying to encourage to get started on an exercise routine. And so I just wanted to kind of go over these 10 tips to get started, because as we discussed, research is showing, again, that regular exercise can help to slow the progress of the PD symptoms. So with your doctor's guidance too, when you're ready to get started, these are some tips if there's any kind of question or any kind of anxiety about getting started that you might find helpful. So one thing to say is start today. Try not to wait. Once you, again, have that discussion with your doctor, try to get started as soon as possible. If you would like, you can always observe one of our classes first. That way you can get a kind of a better feel of what the class looks like, what the expectations are. It's also a good opportunity to meet the instructor and talk with them a little bit as well. And also at the same time, you get to meet the community too. It might help really put you at ease to see that social setting. And went through that. Another thing too is bringing a friend or family member with you to the first class. That could help to ease some anxiety. And also, even if it's 2-3 months down the road, having that support system too can really help you, holding you accountable, keeping you motivated. You can share in like all of your improvements and your victories as well. Go on to the next one. And if you'd like to try a virtual class, we do offer right around 15 virtual classes. So if that might be something you would like to start with, that's definitely another option. I definitely recommend trying out some different classes. Check out some different formats. We have from boxing to water aerobics, yoga, tai chi, dance classes, voice classes. So maybe trying out different formats, really see what you find you enjoy more. And then also if you're enjoying it, if it's something that you find that you really look forward to doing, it's gonna really help with that consistency and again, that motivation. And try to ease into your new fitness routine. So instead of just like jumping right in, ease into it. I also like to recommend and suggest journaling how you're feeling after you take a class, even throughout the whole week. And you can look at things like how you're feeling, like soreness wise and all that as well, but also how are you feeling emotionally? Are you happier after you work out? Are you sleeping better? And then let exercise empower you. Like I said, again, it's fun to learn new things, new drills, and just use that as an empowerment and again, motivation. And most importantly, have fun. That's what I want exercise to be fun for everyone too. We know the benefits of it too, but we want everyone to have that enjoyment and joy to come out of it as well. Okay. So if you're interested in signing up for classes, you call in, we kind of go over the classes that work best for you. We'll kind of go through these steps next. So we have 2 waivers that we have everyone fill out when they get started. And you only need 1 waiver. Once you fill out a waiver for us, it's going to cover all the classes. So that general liability waiver, that's just the waiver we need completed before you start a class with us. The medical consent form we'll send to you to take that to your doctor, to send to your physician, either your neurologist, your movement disorder specialist, or your primary care doctor can sign off on this, letting us know of maybe any restrictions, any classes they do not recommend. And that does not need to be returned to us right away. We know that might take a little bit of time, but if we could get it within the next few classes you're going to take, we do appreciate that. We have a platform, it's called Wellness Living. That's where we hold all of our classes. So that's our scheduling, that's where we hold our attendance. So we'll set up a profile for you in Wellness Living. And then that way we can get you registered and signed up for the classes you're interested in, because we like to hold that attendance and see how our classes are doing. And also, if we have you signed up for a class, the system will automatically send you an email notification, like a reminder of your class. And if it's a virtual class, it'll include the Zoom link in that notification. And then once we have you registered, we'd like to let the instructors know that you're going to be attending, and we're going to get you going. Yes. Oh, good question. It is, yes, it is integrated into our website, and you can sign up through our website. But if you're having any difficulty there, you can also call in and I can help you get signed up through their website as well. Wellness Living. Because they have their own website. Yes, so through us. I don't know if I'm explaining this very well. So our account through Wellness Living, so I have a dashboard and a database through Wellness Living that I use for Parkinson Association of the Rockies, that our organization uses, that holds all of our classes, all of our participants, all of that information. Am I explaining that very well? Like the video tab, which doesn't have its own tab, but when you go down and toward the bottom of the page, it will show exercise classes for the day. You can click on that, and that will. If you have questions about it, you can call the office registered, so it doesn't have to be the research. Okay. It's technology. Just like cameras and owls. So I'm just going to briefly go through this just for time reasons. And but so going back to the exercise metrics I kind of started with at the beginning, that we partnered with CU Health with their PT research department. We started that back in 2022. We are just wrapping up our 5th round, so it's been about a 2.5-year process. And what they did is CU Health, the research department, put together a series of tests. So there were 4 physical tests. They trained me on how to conduct the tests, how to collect the data. We inputted all that data into an Excel spreadsheet. Then I've continued every 6 months to go back to these classes and test the participants. So our goal was to try to catch each participant each time, so we could get so we would hopefully get 5 rounds of the testing. And we wanted to see how our classes were benefiting our Parkinson's community. And so we were able to get 125 people in 4 rounds, 23 classes. And again, we conducted the 4 physical tests. We also handed out a questionnaire, and that piece of it was to capture the social and emotional picture. So we were kind of encompassing all of that, the physical and the social element of the testing. And so this is what we have found to date. So from our 4 rounds of testing, these were the 4 tests that we conducted. I won't go into a whole lot on that. The number of people we were able to capture for each test, which again was around 125 people. Our baseline was the first time we came out to do the metric testing. So that was our baseline. And then the people that we were able to get 6 months later, so that right there, and then you'll see in this column here the change that was noted. And then the last column, the interpretation. So the first test that we did, it was a 10-meter walk test. And what we found in that 6 months, there was no change. The 10-meter fast. So then when we asked the participants, okay, 10 meters, you're gonna walk this as fast as you safely can. There was found to be a small improvement, but probably not meaningful. Our timed up and go test was a seated walking and turning test. And in that test, again, there was no change. And then the 30-second sit to stand, I don't know if anyone's done this with a PT, a physical therapist, but you're in a chair, you stand all the way up. You sit down, you do that for 30 seconds, counting the number of reps. There was found to be a small worsening, but again, it probably not meaningful. So overall, in that first, the baseline in 6 months, we found that most people were stable over those 6 months. Now, after I wrap up my 5th round of the metric testing, hopefully by late summer, we'll be able to gather all the metrics from all 5 rounds and to be able then to provide those outcomes to the participants that were in our study. Yes. No. Okay, so before, I don't know, do we want to do questions first or do we want to move first? I'll let you decide. Questions first. I know you were testing in boxing, but what other types of classes? Oh, we tried to hit every class format that we had. So pretty much the only class we really didn't gather the information was from our aqua class. And then our voice classes, we didn't test our voice classes, but we did yoga, tai chi, Pilates, boxing, circuit training classes. So those were the classes we were able to capture. What happened to the voice class? That's a great question. That's going to be Angela. So after, so she's going to be talking about the voice and the speech after my presentation. But we do have some singing classes. They're kind of fun. We don't care how everyone sounds. We just want everyone to use their voice. Does somebody else have a question? Yes. Have you thought about ping pong? We are trying to gather places that we can send people to. It's hard to find, and it's really something that's challenging for us as an organization to put together and to organize. But I have been recommending to people to reach out to their rec centers and in Castle Rock. Okay. I believe there was a place like in Lakewood, they were able to find a couple ping pong tables, but then yeah, that's what we've just been trying to really encourage people to do. What's that? You think it would be that valuable? Oh, I think ping pong would be very valuable. Unfortunately, I just don't know if that's something our organization would be able to sponsor. But you know, if there's anything I can help to do to like reach out to different places that your community might be able to talk with and coordinate, we could definitely look into that. Yeah. Oh, of course. I'm sorry. Anyone else? You guys that excited to start moving? Well, I'll tell you what, I'm excited to get moving too, because that's more my thing than presenting. So yeah, if there's not any more questions, we can get up. Anyone who wants to participate, don't feel obligated. But yeah, if you would like to stand up or remain seated if you're more comfortable staying seated. I know if you can kind of carefully push the tables, they're on wheels, just kind of carefully push them away. And then you can have your chair nearby. I wouldn't recommend using the table since they have wheels, but you can use the chairs if you're feeling a little unsteady or anything, if you want something there handy to hold on to. Especially this first, or yeah, or next to a wall or anything like that. The first exercise we're going to do, I would definitely recommend having something maybe nearby that you can kind of hold on to, because we're going to be doing a little bit of rolling back onto our heels. And so that's where I want to be very careful that we don't lose our balance going backwards. So we're going to do some heel rocks. So kind of warming up our lower leg, our ankles, our feet, our Achilles, so that back of that ankle. So what I want you to think of doing is bring your feet maybe a little bit wider than hip width apart. So you just have a little bit wider base. So we're going to roll up onto the balls of the feet. So you're going to lift those heels as high as you can. And now you're going to come back down. And now we're going to roll back onto these heels. This is where I want you to be careful, holding on if you need to, lifting those toes as high as you can. Yep. So just think, come up as high as you can onto your tiptoes. And then rolling back onto those heels, lifting those toes up as high as you can. Now see, this thing moves too. Good. So this is a great exercise to do to warm up the lower legs. Good. I mean, this is great to do too, even if you're getting ready to go for a walk, a run, hiking, anything like that. How's that, Arlene, on those heels? You're doing great. I'm impressed. Let's do a couple more of those. All right, and just shake that out. Okay, so now something that we definitely want to encourage are those big movements. So again, hold on to something if you need to, because we're gonna start balancing on one leg to the other, lifting our knees up as high as you can. So think of lifting those knees up. And then as you get that going, start swinging those arms a little bit. So think of swinging from the shoulders. Good. So think opposite leg, opposite arm, kind of like we're walking. And now as you get going, see if you can make that arm swing a little bigger. We all have different mobility in our shoulders. So if you can get those arms all the way up, great. If not, that's fine too. Good. Let's do a few more. Anybody holding their breath? I find so many people hold their breath when they start moving. Make sure you're not doing that. Breathe, breathe, breathe. And relax. All right, shake that out. Let's do a couple shoulder rolls. Roll it out. Okay. Next up, we're going to do T rotations. This is where you want to give yourself a little bit of room because we're going to get a big wingspan here. So first, let's walk those feet out. Think maybe shoulder width apart again. The wider your feet are, a little bit more stable. You might feel a little bit wider base. Then you're going to bring those arms out to a T, like your lowercase t. Make sure those shoulders are relaxed. So here we're going to work on rotational movement. So we're going to work rotation from our toes, ankle, knee, hip, on the way up to our shoulder, to our neck. So you're going to come across. So think of turning on that toe. You're smashing a bug with that right toe. You're going to bring the right hand across, meet that left hand, and clap. So do your best to face that wall. Now open it back up again. Proud chest, stretch it out. Now let's get the left side. Start with the toe, smash your bug, and rotate, clap, face that other wall. So make that clap there. Get that hand, boom, good. Now pay attention if you're rotating from the foot, from the ankle, knee, hip. Nice. This is something great too that you can practice at home. Again, to just work on that rotational movement. And again, making it big. Let's do one more. Ah, very nice job, everyone. Again, drop those arms down. It's also a nice arm workout, holding your arms up like that for a little bit. Roll that out. All right, let's just do some squats now. Let's work on our legs a little bit. So everybody, kind of thinking on how your back feels, how tight we are in the hip flexors. You find the base, the stance for your feet that's comfortable for you, because we're going to do some dynamic squatting. So we're going to sit down into our squat, just hands in front of our chest. And as we power up, we're going to make a big move with our arm. We're going to open those arms up, big stretch in the chest, bring it back in. So think of you're sitting in a chair and then you're opening up. Good. So sit back in that chair, your chest is up, and then open up. So let's see if we can power up from that squat a little more. Up. Good. Try not to smack your neighbor. Boxing's coming up in a little bit, so somebody might be getting back at you. Okay, good, good, good. Let's do a couple more. Up. And again, make sure you're careful. Make sure you're breathing. Think up. Good. Let's do one more. And up. Nice. All right, bring those arms down again and roll that out. Okay, let me see. Okay, we're gonna do a quick like balance, kind of a balance exercise. And then we're gonna do just some boxing combinations, because that's my thing, that's my love. So we'll work on some boxing combinations as well. So maybe give yourself enough room so you can take maybe 3 steps. I don't know, if you can, if there's enough space. We're gonna walk the plank. So what we're gonna do, I used to be a police officer back in the day, so I joke with my class, or we're doing a sobriety test. whatever you want to call it. So we're going to go toe to heel. So you're going to place one foot in front of the other, getting that heel to that toe best you can. And then you're going to bring the other foot in front, heel to toe. It's more challenging than you think. Good. Heel to toe. Good. Now, if you want to, you can turn around and go back, or challenge yourself going backwards. Heel to toe. Heel to toe. Again, watch out for your neighbors. Don't want anybody tripping over anything. And heel to toe. Good. And then when you're doing something like that too, you can add other components in it. I mean, if you want to have fun with it, you can do the, you know, or you can just do, you know, in and out. You can have fun with it, but it really does challenge your balance. So those are things, again, you can practice at home as well. Let's do some boxing combinations. So now you just need enough space in front of you so we can throw some of our punches. So see, everybody gets excited when you like throw punches. Okay, so what I tell everybody is I'm going to set you up like we are getting in the ring. So how many of you are right-handed? Okay, so you're my orthodox fighters. So you're going to start with your left foot in front, your right foot behind you. So if you start in a neutral stance, you're just going to take that right foot just a small angle step back. So you want to be closer to shoulder width, not so narrow, because again, you want that good base. You have a good solid base. Now for my left-handed folks in the room, you're my southpaws, so you're going to do just the opposite. Your right leg is going to be in front, bring your left leg back. And then ultimately, it's whatever stance you're comfortable in. But okay, so from our stance, we're going to bring those hands up right by our chin, elbows pointed down, because you start chicken winging it, it's going to really put a lot of stress on your shoulders after a while. So hands are up, elbows are pointed straight down. Good. Try to soften your knees. There you go. So you feel like you have a good base. All right, good. So from here, we're going to throw a jab. So that lead hand, that's your jab hand. So you're just going to extend that punch straight out. Good. And then come right back. So your two middle knuckles are pointed straight ahead, and then bring it right back. That cross hand or your other hand stays right by the chin, and just jab it out. Good. So that's our jab. All right. So bring that jab hand back to the chin. Now we're going to work our cross. So our cross punch, this is where that rotational movement comes in. So you're going to start with that rotation or pivot, smashing your bug with that right foot. You're going to turn from toe, hip to shoulder, and that's your cross punch. And then you're going to bring it back. So think good, full extension. Just be careful that you're not locking out your elbow. Good. There you go. We want to extend, but we don't want to hyperextend or lock that joint out. Good. There you go. Couple more. And then we'll put our jab cross together. Okay. Jab cross, 1-2 punch. So you're just going to throw 1, 2. Good. Bring it back. 1, 2. And see how this makes you think you're learning these punches, and then we're building our combination. Because we have 2 more punches we're going to get to. Good. One more. Let's throw our hooks. So our hooks are going to come, kind of think from your rib cage. You're going to lift that elbow up, and it's like you're hooking it across. So your forearm kind of comes across your chin, and then you bring it back. So you hook it across and bring it back. Just forearm is just parallel to the floor. Bring it back. Once you get it, then you can kind of think of throwing the hip and shoulder into it a little more. Again, get the whole body working. I'm loving this, everyone. You guys are looking great. All right, now let's get that rear hook, so that back hook. So, and I don't see right or left, just in case you're in different stances. So we're going to take that back arm, same thing, throw that hook. Now from this rear hook, you might feel it a little bit more comfortable to throw your hip and shoulder into it. That's where we get our power. Beautiful. Now watch your wrist. You don't want your wrist to bend or break, so keep it nice and straight in line with your forearm. Let's do one more. All right, let's throw a jab, cross, hook, hook. So 1, 2, 3, 4. 1, 2, 3, 4. And again, is everyone breathing? Okay, good, good. It's funny when I ask my class that, how many people tell me they're not. Good. Let's do a couple more. And we're going to add uppercuts. Good. All right. Uppercuts are fun. So with our uppercuts, your fist is facing you, palm to the ceiling. So you think you kind of dip a little bit and you pop it up. So this way we get our whole body involved and not just the arm. So a little dip. Think that elbow is kind of down by your rib cage. Pop it up. There you go. Good. Nice. Oh, good, good, good. All right. Let's do the other side. Do the other side. Uppercut. Uppercut. Good. Let's get one more. Okay. And now we're going to do a couple punches with some defense, and we're going to call it good, okay? So let's throw jab, cross, hook, and now we're going to do a slip, slip. So you're dodging those jab crosses. You're just getting side to side, a little side to side movement, okay? Jab, cross, hook, and then a slip, slip. Get your defense in there. All right. Jab, cross, hook, slip, slip. All right, one more, and we're going to add one more punch, and we're good. Jab, cross, hook, defense, slip, slip. Good. One more. Jab, cross, hook, slip, slip. All right, are we ready to add one more cross to this? It's our knockout punch, guys. We're going to end with this. Knockout punch. Let's go. Jab, cross, hook, slip, slip, cross. Jab, cross, hook, slip, slip, knockout punch. One more. Knock them out, knock them out. And cross. Good job, everyone. Thanks for all of that. Thanks for letting me get up and get everyone moving. Great job, everyone. I hope this inspires those of you who have not tried a class to check out our classes, whatever you find that might be enjoyable for you, okay? Any questions, let me know. I'm happy to help anyone out with any questions, okay?
Yes, I was going to mention those two, and there's an individual up in northern Colorado, Antonio, I think it's Barreras, I'm not sure, Banderas, something like that, who is really trying hard to bring ping pong across the state of Colorado. I know they just started 2 ping pong days in Colorado Springs now. There's a couple that are weekly in Fort Collins, but as we learn about those, we will put those on our website on the community page and share them. And then Delisa, there is a community class list on our website, the same place where you find all of our classes. We have a community class list, and everything has to be under $10 to be listed on our list. So you can also find other classes there that aren't necessarily park classes, but would be great for you. So as we find out about new ping pong classes coming up, we will definitely add those to the community list. And then pickleball too is something else that a lot of people are doing and having fun with, and it's great. Again, it's great coordination, great skill set, good cognitive, but be careful because I hear there's a lot of torn Achilles and sprained ankles, and so I think people get out there and think it's really easy and go to town, and it's not as easy as they think. So just remember that. I am going to work to get the PowerPoint up, and while I do, I'm going to let Angela Halpern, our next speaker, introduce herself.
Thank you. Sounds good. I just recently tried pickleball for the first time, and I took a class. I am not coordinated, and at the end I was like the kid on the playground who nobody wanted to pick for their team. So I think I have some learning to do. Okay. This is, oh, maybe if I try, I don't know if that's gonna be. I guess just let people online say if they can't hear me. All right, so My name is Angela. I'm a speech language pathologist. I'm fortunate to be on the board of the Parkinson's Association of the Rockies. I've been a part of the Parkinson's Association for many, many years as a speech language pathologist, recommending all the wonderful programs to people that I've worked with. I have been a speech therapist for 32 years now, and the majority of my career is with people with Parkinson's. So I'm very passionate about what I'm going to talk about today, and that will probably come through as we're talking. I am also Chief Clinical Officer with LSVT Global. It's the company that provides training to therapists in some of the treatments we're going to talk about. And then I also have a private practice in the Denver metro area. So that's a little bit about me. I want to acknowledge Dr. Cynthia Fox. I work with her, and she also helps with some of the information in this presentation. Few disclosures. As I said, I'm an employee of LSVT Global, which provides the education for some of the treatments we're going to talk about. I do have some videos I'm going to share with you. Many of the wonderful people in these videos have given of their insights for us to share these videos, but we just ask they're not reproduced for other use. Okay, so what are we going to talk about today? I'm going to move over here without tripping so I can see. We're going to cover the background on speech and voice in Parkinson's, talk about what's the current state of art for that treatment. I'm going to highlight LSVT Loud as one example of behavioral treatment for Parkinson's, and I'll talk about why we're using that as an example. And then we'll finish with some general tips, communication strategies, talk about devices, community activities. Some of this will piggyback off of some of the things Delisa already talked to you about. So this is a statistic I continually find a lot of people are surprised about. With Parkinson's disease, people are more familiar with movement, right? We see tremor, we see shorter shuffling steps, things like that. But many times when I talk to people about speech therapy, they say, why would I need speech therapy? Well, we see that up to almost 90% of people with Parkinson's will have a problem with voice and speech at some point. And these are some of the characteristics that my clients notice that are noticed globally. Reduced loudness. So for any of you in here who either have Parkinson's or you're a care partner for someone with Parkinson's, how many of you have noticed reduced loudness? Okay, this is one of the hallmark ones a lot of people note. A hoarse, breathy voice quality can be really common. Some of my patients tell me their voices are monotone. They feel like they don't have the inflections they used to have. Sometimes people notice some slurring, imprecise articulation. And just like you might have a tremor in the limb, your voice, and I'm going to show you a video of your voice box here coming up, it's a muscle. So you can get a tremor at the level of the voice as well. Some people actually notice problems with their voice and speech before they're even diagnosed. So as speech therapists, sometimes people will come in and see us and, yeah, I don't know what's going on. My voice just feels different. And then as a speech therapist, we may see other signs and symptoms and say, you know, maybe you should go see a neurologist. So does this matter? Yes, it matters. Even people who maybe aren't really overtly noticing these symptoms will talk about feelings of embarrassment, social stigma, isolation is one I hear a lot. People can't be heard and understood, so they withdraw. These are the types of comments as a speech therapist that just break my heart. And I'm like, let's get in because there's something we can do about this. And a comment from one individual, if I have no voice, I have no life. This is how we express our essence of who we are. So I'm going to show you a video now. This is of a woman who was sharing her insights, her perception of voice before she had treatment, and highlighting some of those feelings of isolation that I was just telling you about. Can you tell us when did you first notice changes in your voice?
Notices of my speech. I think initially when I was 2015, I had mentioned to my neurologist that no one had really made a comment on my case. It's just that sometimes you might be with a group of people and make a comment that wasn't getting a response. And things weren't being addressed in whatever comment I had made. I wondered if people had heard me or if I had been clear. So that was more my concern with my speech initially. Well, I actually sometimes would feel ignored because no one had responded to what I had commented. And it makes you feel unimportant, I guess. So kind of like, what's going on here? Why am I not getting response or any response?
And unfortunately, that's a common perception I initially get from patients who come to see me, and they're feeling ignored or unimportant, and they're not realizing that it's just because people can't hear and understand them. Still have the important things to say, they just need to be able to be heard. So have any of you ever had your vocal folds visualized, gone to an ENT doctor and they've done a scope to look at your voice box? Okay, well, I'm going to show you a video now. If you've never seen vocal folds, you're going to see them now. Basically, what they do is they go in with a camera and they angle it down. It doesn't go down your throat. It's just angled kind of like when you go to the dentist. And they can look at the vocal folds. So in Parkinson's disease, we see there's both a motor and a non-motor aspect that impacts voice and speech. And we're going to talk first about the motor. So as you may have learned in some of your first sessions with the PD 101, in Parkinson's, we have a hypokinesia, which means reduced amplitude of movement. We can also have bradykinesia, which is slowness of movement. Again, we tend to see that a little more in walking, decreased arm swing, so that hypokinesia, bradykinesia. The muscles you use for voice and speech are impacted by this as well because they're muscles. So we see the same thing across the motor speech system. Voice and speech may be underscaled than what they were before. So in this video, you're going to see the vocal folds. I'll go ahead and play this. So the white, those are the vocal folds. That's the entrance to the airway. And this person has a gap right here. Even when cued to be loud initially, there's still a little bit of a gap. That results in a breathy, soft voice. Now, after treatment, voice therapy, you see that gap closes. So that results in a stronger voice. A voice that isn't breathy, isn't hoarse. So there's actually a physiological reason for some of these changes. Also, decreased breath support. All that can go together to get that quieter voice. The non-motor impact that we see that can happen is this reduced amplitude of movement. I'm going to move back over here so I can see all of these. So we get this reduced amplitude with that hypokinesia. And in Parkinson's, this can be perpetuated by an abnormal, what we call sensory feedback. So what I mean about this is many times patients come to see me and they're not aware their voices are quiet. Their voice feels normal to them. So there's a reduced awareness of this vocal loudness. And so people don't correct because the voice feels normal. So that quiet, soft voice, when I ask someone, they'll be like, yeah, that feels normal to me. And then when I ask someone to get to a normal loudness, they'll tell me, I can't talk like that. I feel like I'm shouting, okay? And so that's the sensory aspect. So many times I run into people and they've heard about the motor aspect, but they've never really heard about this sensory mismatch that can happen in Parkinson's. So what happens is the self-perceived voice might be this quiet voice that feels normal. But to the listener, they're having a hard time hearing what the person is saying. If I ask someone to get to a normal loudness voice, this is what it feels like to them. But to the listener, they're like, yeah, you sound great. So For those of you in here, have any of you thought, if you have Parkinson's, have any of you ever thought your spouse needs a hearing aid? Yep, okay. Sometimes spouses do need a hearing aid. I'm not negating that. But many, many times what happens is when someone comes into my office and I say, you know, do you have to repeat? Yes, but my spouse needs a hearing aid. And so I'll record their voice and I'll play it back and they're shocked. And they're like, oh, I really am quiet. Okay, I didn't realize that. And we'll touch on that in just a bit, in a little bit more. But I want to play this other video now of some of these perceptions of voice and what that's like of this mismatch, the sensory mismatch.
Were you the first one to notice it, or were other people commenting on it?
I had to I thought I was sounding great. Part of my concern, I was not dealing with Parkinson. I had to diagnose part of mine. Friend had the plan when I heard that, but not expecting 44 years old. And I just decided that now I had to keep going. But mentioned before, my wife is a speech and language therapist, and she said to me two things in the first 5 years of my diagnosis. She said, you need to deal with this, and you need to speak up. And I said, well, deal with things, I'll hear that one. Your voice is getting soft. And I said, no, it's not. He said, yes, it is. And of course, my wife's all right anyway, so. And the first conversation I had, each night, other than my wife, and regarding my voice, and we just sat down at the table, and she would have voiced that to me, and we talked for about 10 minutes. And she wrote down stories that she's telling, going up through the voice. At the end of the conversation, she showed me my scores, and they were around 48, 49, 50, maybe, and I thought, that's pretty good. Then she showed me her scores, and they were doing 89, 90, 91. She wasn't shouting. The difference. No. So that was the first time.
I felt being out again and again what I was saying. So I just like I went to sit down, watching television, and assume that they heard me, but really have to speak up because of the other noise, things like that, or whatever. So I noticed that I was being asked about how I figured out I really had to work at it. Not only just work at it, but think about it.
So some insights there that have touched on what we've just been talking about. And what we see is that this isn't a peripheral issue. So people with Parkinson's who have normal hearing experience this. People with Parkinson's who have a hearing loss experience this. And as I mentioned, if I record someone's voice and play it back on a tape, they can hear that their voice sounds quieter than my voice. They can also hear that when I get them to a voice that feels like a shout to them, it's really not a shout. It sounds like normal loudness. So it's a central issue, not a peripheral issue. And so we're going to talk about, when I get into the treatment, how we address that. Now, many times people ask me, do my medications make an impact on my voice and speech? And what we see is that while these medications for Parkinson's can vastly help with movement, they don't have that same impact on voice and speech. Likewise, surgeries like deep brain stimulation that can be wonderfully helpful for movement also do not consistently improve speech, and in some instances make it worse. So there's a need for something beyond medications, beyond surgery for voice and speech. And at the time that Dr. Ramig, who developed the treatment we're going to be talking about in 1987, started doing her research, the consensus was there were not effective voice and speech treatments for people with Parkinson's. So unfortunately, neurologists would not refer for speech treatment because they're like, there's nothing that works. And which again is really devastating that there wasn't something people could do. And luckily that is not the story now. So the LSVT lab that we're going to talk about, LSVT stands for Mrs. Lee Silverman. It was called the Lee Silverman Voice Treatment. So now we just call it LSVT. She was the first person who started the research with Dr. Ramig all the way back in 1987. And her family said, as do many families, if only we could hear and understand her. I'm going to show you a little video now of a woman who was 59 years old at the time the pre-video was taken. And whoops, let's go back a second. You're going to see her immediately post this voice treatment that we're going to be talking about. And then we actually have a video of her 8 years later. So that's the thing I also want you to keep in mind about intensive behavioral speech treatment is that intensity works long lasting, okay? She didn't have a change in medications pre to post. So this is just as a result of the speech treatment. So let's look at her pre. This is after 1 month of treatment.
Oh, yeah. I talk louder, I think louder. I was going to sit with some of the results of my earbud, they my friend. Excellent. What practice? My eyes, do I nose? And I read up the nail out loud. Oh, yeah. Majority of the time, it wasn't my husband, and they went, I can't stand now. Oh, yes, I said some of our friends back from the north, I talked about. My daughter said, oh, Mom, that's you. Oh, yeah, because now she gets it. I didn't understand what she said. Yeah, no excuses. But think loud. You find the speech therapy beneficial? What were the changes you noticed right after? The voice is stronger and it's louder. What percent of your speech do you think is intelligible? That is to say, people can. And we said you've been practicing. How often do you practice? Oh, about 5 times a week. Do you really? Surely. I'm not going to do it. That is phenomenal. And have you done it like ever since you ended? Do you feel like practice helps? Oh, yeah. Let's do one more. wants to say. The whole train is out. Never thought that in your, once you were heard, everybody wants to talk to you.
So some great words of wisdom there. And so she did continue, when we think about exercise, the things Delisa talked to you about, she did continue to exercise her voice, but you see 8 years later where she's at. So that I mentioned this started in 1987, the treatment we're going to talk about. And luckily it coincided with this time that we call the decade of the brain in the 90s. And this is where we really started to recognize the importance of activity-dependent neuroplasticity. What do we mean by that? We mean that how activity, exercise, therapies can help to induce neuroplasticity. So that's important in light of Parkinson's disease. So basic science has really provided this evidence and elevated the value of exercise for people with Parkinson's. So some key principles that we know drive this activity-dependent neuroplasticity are that treatments need to be intensive. Okay, so Delisa mentioned some for general exercise, the importance of intensity of some of those. She gave you guys some good guidelines on that. For behavioral treatments, therapies, I'm going to talk a lot about intensity and what you need to make that change. They need to have a level of complexity for us to make change. They need to involve some repetition, but it's repetition in a good way. Every repetition matters and counts. Salience, you need to practice things that are important to you. So I'll show you some examples, but in speech therapy that I do, it's never a workbook. It's always, what are your hobbies? What are your interests? What are your goals? And that's what we work on. And then it needs to be specific. So we talked about that hypokinesia in Parkinson's. You think about this idea of loud, we're increasing amplitude across the motor speech system. So directly targeting specifically what we see in Parkinson's. So research has demonstrated that in these animal models, exercise can improve brain functioning and may even help to slow symptom progression. So really changing this idea that what you do in exercise is medicine. I am a big proponent of early intervention with therapies. So I can't tell you how many times I talk to people and they say, oh yeah, that was really interesting to learn about, but I don't have problems with my voice and speech yet. I'll call you in 5 or 6 years. When we think about these principles of neuroplasticity, early intervention is important. Learn what to do to keep the system strong before you're starting to notice improvements. It's much easier for me to work with someone and be like, here's what we need to do, versus my voice is way down here and now I have to build it back up. Now, that's not to say I don't work with people at all levels and we can have outcomes at all levels, but it is just a caveat of, don't wait till you feel like this is really a significant problem. So those early interventions with therapies can be helpful. Also, therapists can help to, beyond restoring and optimizing function, talk to you about different types of activities to maintain that function that you've acquired. So today in the world of Parkinson's, we can make a difference, and that's the good news. There's Parkinson's specific approaches for voice and speech. And as we said, not just late stage referrals. And luckily, many of the neurologists that I'm familiar with are now recognizing this as well. So they may be talking with you about voice and speech, physical therapy, getting in for those referrals. And then that ongoing maintenance and community engagement through many of the different types of exercise classes you've already learned about. And then evidence-based practice. This is really important. You have a lot going on. You're going to doctor's appointments. You're doing family things. You're trying to exercise. You're trying to do all these things. So I always tell people, if you're looking at any type of therapy, not just speech therapy, but any type of therapy, make sure it has evidence to support it. You don't want to do things that are a waste of your time. So find out what is the evidence, and then that's the one you want to pursue. And on that vein is why we're going to use LSVT Loud as an example of what we're going to talk about for speech therapy. So this was a recent article that was put out by Perry et al. In 2024. And they basically looked at all the different types of voice and speech treatments that there are to treat dysarthria, Parkinson's disease. And the authors of this article concluded that out of all these treatments, LSVT Loud had strong evidence. And in fact, it was the only one that had that level of evidence. They felt the other treatments needed more evidence to support. So whether you're looking at physical therapy, occupational therapy, things for swallowing, I just always encourage you, medications, what is the research evidence behind that? You heard in that video I showed you pre-post and 8 years later, the increase in loudness in Shirley's voice. And we would expect that because that's what we're focusing on is loudness. But what you may have also noticed was improvements in her articulation, improvements in her respiratory support. I mean, she could hold that off really long. You may have also noticed changes in her facial expression, the smile, the twinkle in the eye. Clinically, we see this, and so we've also studied this with research. What we find is that the beauty of that one variable of think loud increases amplitude across the whole motor speech system. So you don't have to think about breathing. You don't have to think about articulation. You don't have to think about all these other things. People just think loud, and all these things happen through the treatment. And so this just shows you some of that that's been researched. We also, exciting, have pre-post neuroimaging data. So when we think about those principles of neuroplasticity, what's happening with the brain, there's actually some neuroimaging data with that as well. I spent many years of my career doing research. I kind of geek out on research, so I'm keeping this brief here. But if anyone wants more details on research, I would be happy to talk to you about it. All right, going the wrong way here. We get the question sometimes about, does it work globally? And yes, it does. We see it clinically implemented globally, but also there has been research done globally. And the reason is, when we think about Parkinson's, when we think about the motor and the non-motor, that impacts someone whether they speak German, whether they speak French, whether they speak Japanese. So we can see the same impact, plus when we implement LSVT Loud, we can see the same types of improvements. And I have been fortunate, I'm a faculty to train other speech therapists in this approach to be able to travel globally. And what's great is we do a lot of demonstrations with these exercises. It's based mostly on modeling, not a lot of explaining. I can work with someone who speaks German. I don't speak German. I can show them what I want them to do, and I hear the same sorts of changes that I hear with my patients who speak English. So before we get into some of these key concepts, any questions so far? Yes, sir. So the excellent question is, does the speech therapy also include swallow therapy? This particular treatment does not also include swallow therapy. The treatment, getting everything done in itself is intensive to just get done in an hour. But do people with Parkinson's notice issues with swallowing? Yes, they can. And definitely important, that would be a whole other hour presentation. But if you're noticing any issues with swallowing, be proactive, tell your doctor, get in for a swallow study. There are specific exercises that can be done to help with swallowing. Now, having said that this doesn't involve swallowing, you may have seen on that previous slide with the spreading of effects, there was a swallowing article on there. So we do have preliminary data showing following LSVT Loud, some people have noticed changes in swallowing, but that data is preliminary. So at this time, we don't say it's a treatment for swallowing, but might you notice some changes? maybe. Excellent question. Any others before we go on? Okay, so let's think about that hypokinesia again, reduced amplitude of movement. So I want all of you, just in your typical voice, to say on the count of 3, good evening. Okay, 1, 2, 3.
Good evening.
Okay, so now what I want you to do is I want you to do that again, but I want you to think loud. So say good evening in a loud voice on the count of 3. 1, 2, 3.
Good evening.
Woo, beautiful, wonderful. So what you all did without cracking an additional synapse is by me just saying loud, I was watching, many of you sat up straighter. You took a deeper breath. You put more effort to your whole system, which resulted in a louder voice. Many of you opened your mouth more. So this is a very simple example of the beauty of the efficiency of that one cue to make a lot of changes across the whole system. So LSVT loud, we're just focusing on that voice, but we see a spread of effects across the whole system. It keeps it efficient. The mode is intensive and high effort. And many times when people ask me about the treatment, and I say it's 4 times a week for 4 weeks, they say, wow, that seems like a lot. And if you really break it down, it's 16 hours out of an entire year. So it's really not a lot. It's just different than what traditional speech therapies did. But traditional speech therapies weren't effective because we know from principles of neuroplasticity that from a speech therapy perspective, we need something intensive if you want change and you want change that's going to last. So it's those 4 consecutive days a week for 4 weeks, 1 hour individual treatment sessions. So it's not group therapy, it's one-on-one. There's a lot of things the speech therapist is doing to get your voice to normal loudness without any strain, doing it in a healthy way. There's also daily home practice, takes about 10 minutes a day. And it's delivered by a therapist who has been certified to deliver the treatment as it's been researched for over 30 years. So this treatment has over 5 randomized controlled trial studies and 30 years of data. So you want to make sure the therapist is doing the treatment the way it's been researched. There are currently about 21,000 LSVT loud certified therapists in 78 countries. So many times people say, are there therapists near me in Denver? Yes, there are. And there are therapists available globally. So what do you do in a treatment session? What happens in the hour? The first half of the session is really what I call the weightlifting for the voice. This is where we're really strengthening the voice. So the first exercise we do are those ahs that you saw in the video that she did pre to post. So you guys have been sitting for a little bit. I know it's also chilly in here, so we'll get warmed up a little bit. I'm gonna have you do an ah with me, okay? So everybody get in that good, there we go. All right, I'm gonna do one first. I want you to do what I do. I'll do it first. Ah, I'm gonna have you do that and hold it out. Here we go, 1, 2, 3. Keep it loud. Keep going. Keep it loud. Keep it loud. Keep it loud. Keep it loud. Okay, I won't make you hold it as long as we had Shirley hold it. But this is another reason that treatment is individual, because some people can hold an ah for 3 seconds. That's fine. Other people can hold an ah for 30 seconds. So with intensity, we want to push each person to where they are. It's not against some normative data. So we do a minimum of 15 of those, and the therapist is listening. If I was one-on-one with you, I'd be listening to make sure your voice is produced in a healthy way, that there's no strain. And the idea is we're always getting this translation of a stronger voice for speech. I mentioned earlier, people notice their voices can become monotone. So this next exercise is to really help get more inflection. So I'll do one first. We're gonna start with that same strong ah, and then we're gonna stretch it up. So ah, okay, here we go. 1, 2, 3, think loud. Ah, keep it loud. Super. Those you don't have to hold as long. If I'm working one-on-one, I would see what's the highest someone can go, keeping that loudness. Again, very individual. Let's go down. I'm going to do one first. Ah. So same strong ah voice. 1, 2, 3. Ah. Keep it loud down there. Okay, good. It can be harder to stay loud on that low. So we do a minimum of 15 of each of those. So you can start to see how this is really kind of that weightlifting for your voice, strengthening that whole system. The next thing we do is I have people think of 10 things they say every single day. We practice those in the normal loudness voice over and over. So when they go home and they happen to say one of those phrases, it reminds them to be loud, okay? So one phrase that someone used that is also a personal favorite of mine, and it's about that time, is it's cocktail time, okay? So in your voices, in your good, loud, ah voice, I'm gonna have everybody say, it's cocktail time, okay? So here we go, 1, 2, 3.
It's cocktail time.
Woo! All right, I think you guys need to bring in the cocktails. All right, so you would pick whatever those phrases are. I had someone tell me once, you know, I should tell my wife I love you. I don't say it as much as I should. So we put that in as one of his phrases. His wife hearing now in this loud voice, I love you, I love you. She became my new best friend. So it's really personal to each individual. So that's the first half. The second half is where we bring in that principle of neuroplasticity of saliency. So this is individual to each person. We find out what are your hobbies, what are your interests, what's important to you, and that's what we read or talk about. So it starts simple, week 1 at a word phrase level, gradually gets more complex to conversation by week 4. I love this part of therapy because I have learned so much. I had a gentleman once who liked astrophysics. I knew nothing about astrophysics. At the end of a month, I knew a lot about astrophysics. So it would be what's important to you, and we incorporate that. And then there's home practice and carryover. Also with the salience, all the activities I'm working on are to get outside of the treatment room. Who are you going to be talking to? What are the situations you need to communicate in? Those are what we're going to focus on. And all that's done through some of the home practice and carryover. I've had people who were real estate agents. We role played. I was the client. They had to give me a house tour in their loud voice. I've had people who are lawyers. I'm the jury. They have to plead their case. So whatever is important to you, that's what we work on. So the goal of treatment, yes, those initial exercises are important, but you're not going to walk out of my treatment room, go to the restaurant, sit down, look at the waiter and say, you're going to go to the restaurant and need that strong voice to order your dinner and be heard and understood. Calibration is an essential part of this treatment. I could do all the beautiful exercising with you I wanted for a month. Be great. You'd feel like you got a workout. But if I don't address that sensory mismatch we talked about at the beginning, you're not going to use that voice outside of the treatment room. Because to you, it's going to feel like this, and you're going to feel silly. You don't want to use that voice. So an important part of treatment is addressing that mismatch. Throughout all of my treatment sessions, I have a recording device running. I play back the voice. See, that voice that felt too loud really was normal loudness. See, that voice that felt normal to you, how quiet it is. My goal is that each individual learns how to internally cue what is normal loudness and can independently do it. But that takes time, takes a month of treatment to do that. So what we really see from this is what you do in therapy sessions matter. Specificity matters. So you want to directly target what we see in Parkinson's, that hypokinesia, the bradykinesia. We want to directly target increasing amplitude across the system. And it's essential that we target that sensory calibration and improving awareness. What we see clinically and through this research is LSVT loud might provide this cortically driven enhancement that can spread across the system. It's also a lifelong model of care. So early intervention, get that intensity that's required for neuroplasticity of the one-on-one 16 sessions, and then you're going to continue to practice. Takes about 10 minutes a day. Then also participate in group activities. So Delisa was mentioning the Big for Life for movement. Big for Life is the partner physical therapy of LSVT Big is the partner of LSVT Loud that I've been talking about. So Big for Life is a maintenance class after people have been through the one-on-one LSVT Big therapy. Loud for Life is the maintenance class after people have been through the one-on-one treatment that we just talked about. And then continue to see the speech therapist. I tell my patients, you are stuck with me forever and ever, amen. Parkinson's is lifelong, so I'm there on that journey. So I check in. How are you doing? What do you need? How's the practicing going? Do we need a few little tune-ups? On the note of Loud for Life, PAR does offer a Loud for Life class, and I get to teach one of those classes. It is the highlight of my week. I love teaching the class. We currently meet mostly virtually. We do a few in-person sessions. So people in the class have all been through LSVT Loud therapy, and now they come to class. And what they talk about is that camaraderie of other people understanding what this voice and speech issue is like, how it feels when people say, no, you're really not too loud when it feels too loud, and that support. So this is from some individuals that are in one of my Loud for Life classes.
Several times there are the individuals that they kind of start out low, but what I find myself doing is speaking louder to them, trying to encourage them to speak louder, about how to, I try to hear back to them what I think you need to do. Because speaking so low.
I feel that's a motivator for you to speak to them louder, to get a model for them.
Yeah.
The camaraderie is part of the words, because there's a difference in bonding that took place probably from day one. And I think one of the things that we do the best of all is to laugh together. I've never been to a loud class, for life class on Zoom, with this international group, and there was constant laughter throughout the whole hour and a half or hour and 10 minutes that we're together. So I think there's a comfort level that's developed in these conversations, and it also gives us the opportunity to not fear speaking up when someone's not speaking up, and try to give them the encouragement, because that's what they're wanting in the meeting. That's why they're here to speak with us.
Honestly, you're so right. I mean, it's incredible that bring together the 15 or 20 strangers who've never met before, and don't know each other, and bring 10 or 15 minutes of talking and doing their loud out, up and down out. After, even the first meeting, there's that sense that there's something special. And this is doing something that somebody that 30 everybody helping us with our dialogue and speaking and everybody. We've given people a real sense of connection, sense of work, because Parkinson is supposed to do it does, but I mean, we can find that, and this is something that makes a difference. And most strangers meet on the internet, they meet and help each other, and they're one of the same time. I think that's something very amazing. Just wonderful. Comfortable and confident being part of it. You know, it's just really quite amazing and creative. And to have someone that particularly important.
So the first part of a Loud for Life session is practicing all those exercises. And then the second half is some different conversation activity depending on what the class members want. And many of the activities are driven by them. So we do book reviews, movie reviews. We recently did a barrier task. So again, this is on Zoom. And imagine if I was in a little room with one of you and I'm describing something for you to draw and you don't know what I'm describing, and then everybody holds up their picture to see how close they got. So you have to have good communication for this to come across. Well, some of the people were laughing so hard at the drawings that I was popping into their room and they had tears running down their face. So it's just a lot of good fun and support. So what are other types of community-based activities? Doing things that are salient, that are real world. As Delisa mentioned, whatever kind of exercise you do, have it be something you enjoy, because then you're going to keep up with it. So if you're doing a boxing class, great place to exercise your voice. You know, you're counting, you're calling out the different punches that you're doing. If you enjoy singing, singing can be great exercise. And then, you know, other things you may be involved in, book clubs, things like that. I get asked sometimes, are there devices that can help with my voice and speech? And we always say this is best to do in conjunction with a speech therapist. I do not recommend just going online and you see some device that you think is going to help and ordering it, because different things work for different people, and you want to work with a speech therapist who can say maybe that would or wouldn't be appropriate for you. This first one, the Speech Vive, is designed to really increase vocal loudness using the Lombard effect. So the Lombard effect is that what happens to all of us if we get in a noisy room, we bump up our loudness because our environment is telling us to do that. So it's a device you put in your ear, and it introduces noise into the ear with the idea being to bump up the loudness. The LSVT Coach is a software that gives feedback, and that's for people going through LSVT loud treatment. Speak Easy is a device that more helps for people who are having a lot of issues with fluency of their speech. Their speech is really fast in rate, and they need something to help with that. Many times people ask me, what about amplifiers? So in certain situations, amplifiers might be helpful, but I always say, try behavioral treatment first, because you will most likely be amazed at the loudness you can increase on your own without a device. Also, think about if I have a slurred, mumbled, quiet speech and I put an amplifier on, the amplifier is just going to amplify my slurred, mumbled speech, okay? So rather, if you do something that's increasing not only that loudness, but the articulation, that can be helpful. And then there are other things such as picture boards, alphabet boards, computerized devices that can be helpful, but again, in conjunction with speech therapy. And I always say, try that speech therapy first. So some tips to improve your communication. I think you've gotten the message from me. The first tip would be participate in speech therapy. But until then, talk louder. Now, that sounds easy to say. And for those of you who are care partners, you're going to think, well, I can tell them all day to talk louder, but they don't keep doing it. This is why we need a month of intensive treatment. We are retraining a motor system, retraining the sensory system. So that cue for either you to talk louder, or the cue for someone to tell you to talk louder, can be helpful, and you can be cued to do it, but it's hard to maintain without that treatment. Reducing background noise if possible. So turn off the TV, turn down the music. Pick a restaurant that maybe isn't as noisy, or go at a time when the restaurant isn't as noisy. You know, really get the eye contact of someone you're talking to. Get their attention before you start talking. And then if for a person with Parkinson's, if you know there's times a day when you just feel, whew, try to plan those longer conversations for times when you have more energy and you feel like you can put a little more into that. It can also be helpful sometimes to speak in shorter phrases if it feels difficult to get that voice out. And then if you're a care partner, the reverse. If you have a conversation, try to plan it for a time when you know the individual will have more energy. And then really provide validation. When you hear a voice that sounds good, yeah, I really like that voice. I can hear and understand you when you use that voice. And no, it's not a shout. It sounds great. Using those simple requests to say it loud and asking yes, no clarifying questions can be helpful. So in closing, I'd like to leave you with this quote. It is possible to take charge of your life, even with Parkinson's. It's possible for your will to override your brain, and it is possible to have power over Parkinson's. She is ingrained in my brain, had this wonderful woman I worked with, and she came in and her voice and speech were pretty soft. We went through therapy, and she told me at the end, I have declared war on Parkinson's. And she said, with Parkinson's, you feel like there's so many things you can't control sometimes. And I've learned I can control my voice and speech. And that's another thing I like to tell my patients, even on days when other things feel out of your control, you have that power to communicate. All right, so let's open it up for any questions that you might have. Yes. Yes. Yes, it does. Oh, yes. Oh, I did good on the other one. The question was, does insurance cover the program? And if your insurance covers voice and speech treatment, it typically covers the program. Yep. Which is Medicare most, yeah. Other questions? Okay, everybody ready for cocktail time, I think. Yes, so to do LSVT loud therapy, there are trained and certified therapists all across the Denver metro area. And you all have my handout that has my email, and I am happy to connect you either with someone who lives near you, or you can also do the therapy via telepractice. So you can do it over the internet if you don't want to go to a therapist. Once you have finished LSVT loud therapy, if you want to join a Loud for Life class, or if it's someone online who's already done LSVT loud therapy, you can, again, contact me, or you can contact Delisa, and either of us can get you set up to join that class.